Hey, hello patients, my name is Dr. Wilber and I want to welcome you to your patient orientation class. This is an important class because it covers a lot of information that I want to make sure that you have and you understand. We're filming this here in the office as a courtesy and really as a convenience for the patients so that you don't have to come back on a special trip at night for a class here. So that way if we put it on a disc you'll have it and you can watch it in the comfort of your own home. So welcome and thank you for watching this. When you first came into the office, we sat down and we discussed what your problem was when we did your consultation. We went across the hall, we did your examination, and we might have taken some x-rays of your spine to see what was going on. But at no point in time did we sit down and discuss what chiropractic is. So that's what I'd like to start with you. And first and foremost, even before that, I want to tell you that when you come into the office, look on the wall and you'll see we have our purpose posted up on the wall. And our purpose is we're here to help sick people get well and to improve the quality of your lives and to give people hope. Because many people come here after they've already tried many different routes to alleviate their problems or their sicknesses with no luck. And so that is what our purpose is, and we don't take that lightly. We truly do live that purpose here. Now, back to chiropractic and the five main attributes of chiropractic. The first one is it's preventative. And what I mean by that is if you come in here and you have degenerative joint disease, well, if we can fix the structure in your spine by putting a curve back in it or lining those bones back up, we can help prevent you from getting worse in the future. And the second one is it's non-invasive because, of course, we're not entering your body in any way, shape, or form. It is drug-free and there are no side effects. And the last attribute of chiropractic is it's restorative, which is what I really enjoy working with people on, because again, if you come in here and you have a spine where perhaps your neck curve is going the wrong way or your hips are imbalanced, well, we can restore you back to your proper alignment and restore you back to the proper structure that you're supposed to have, which again goes back to the preventative part because it'll help prevent you from getting worse in the future. Now, the next thing on here is, if I were to ask you in the beginning if you considered me a health doctor or a pain doctor, what your answer would have been before this video versus what it is hopefully when we're done with this. The point I want to get across here is you're designed to be healthy, regardless of what you see on TV or what commercials you see where it says for your normal everyday headache take this, or for your normal constipation take this, or for your normal asthma take this. You know, folks, those things aren't normal. We were designed to be healthy. And with chiropractic, we try to restore you back to your working at your optimum function that you can. Now, the three things that will come about on some people that really limit your ability to progress the way you should are what I want to cover with you now. And the first one is not telling me everything. So perhaps in consultation you forgot to tell me something or you didn't think it was important at the time. Well, when you come back in the office, make sure you go through that with me. Whether it's the fact that you had headaches and you didn't tell me, or we had loss of hearing in one of your ears and you didn't tell me, or any other type of health ailment you might be having that we didn't discuss, tell me everything so I know. Alright, the second thing that I want to go through that might limit your progress is not following through with your care. Okay, in your care there are three phases of care that I've gone through with you on your third visit. And the first one was relief and correction, and then the second one is the healing, and the third one is rehabilitation. In the beginning, in relief and correction, all we're doing at that point with you is getting your joint moving in your spine, getting those joints moving properly, and trying to give you some relief from whatever symptoms you might have been having. And then the second phase and the third phase, the healing and rehabilitation, that's really when you'll get the most benefit from your chiropractic care. But at that point, that's generally down when you're in your, 2 times a week or once a week type thing. In those phases of care, the joint is working better, the joint's starting to heal and it's starting to strengthen, and your symptoms are long gone by then. But that's the most beneficial part because that's when you truly start making changes for your spine that are going to last you the rest of your life. The part I want to go back to now on you is the third thing that might limit your progress is dropping out. well, I guess it's back to the second thing, not following through the care plan, are the phase 1 dropouts, which is people come in, they start feeling better, they think the problem's fixed, so they quit care. Well, the problem with that is we never really got it set long enough to get it corrected. We just got you out of pain and got the joint moving. So don't be in their phase 1 and in the relief phase and get your relief and think you're fixed, because that's not truly fixing the structure that you have. So stick to all 3 phases of your care. And the other thing that will limit your progress here with chiropractic is missing your appointments. So every care plan here that I write for patients is different. It depends on what you bring me, what the x-rays show me, how long you've had the problem, those type of things. So all the care plans are different. So don't start missing your appointments, skipping on your appointments, because then we'll take 2 steps forward and we'll go 1 step back, and it's really going to slow down the progress that we're making. We don't want that. Now let's move on to some more chiropractic stuff. One question I like to ask patients is, how old do you think you have to be to have a chiropractic problem? And you know, some people give me different answers of ages and stuff, but truly it's, you know, when you're born. I've adjusted people here that were 1 week old. I've adjusted my daughter the day she was born, my other daughter the day after she was born, because we're designed with this spine, and if that spine gets misaligned in the birthing process, or maybe when we're 5, when we fall off our bikes, or you know, you're 10, you're falling out of a tree, or whatever, you get 16, you're driving a car and you start wrecking cars, those type of things. Any timeline along that, people can misalign their spines, and they should be checked for chiropractic to see if their spine is misaligned. Now, 5 dangerous words that people generally bring in here that I hear a lot in this consultation room are, maybe it will go away. Because folks, problems don't go away on their own. If you know, you've seen or heard people, yeah, my neck's bothering, my low back's bothering, but it'll go away, it'll be fine. Those are the people that end up coming here 2 years later who have real severe problems at that point. So if you got a problem, make sure you get it checked. All right, let's go through some of the structure of the spine, so when you're in the office and I'm talking with you, we both know what we're talking about. This is our spine column right here. We got our hip here and our tailbone, and we go up this way. We have the neck up here. There's 7 bones in the neck, which are called the cervicals. We have 12 bones in the mid-back, which are called your thoracics. And we have 5 bones down in the lumbars, down in the low area, which are called your lumbars. And you have your sacrum and your 2 iliums, your right and your left ilium. That makes up the spine proper. Now, the thing with this that we have to work on most patients is the curvature. When we're looking at a spine from the side view, what you'll find is this neck should curve forward, and then the mid-back should curve back like this, and then the low back should curve forward again. So we have 2 lordotic curves, and we have 2 kyphotic curves. So the lordotic curves curve forward, like I was saying, and then so does the low back. And the problem with lots of this is we start losing these curves, and we start getting this twisting and rotation in here. And then when that happens, then the structure is no longer proper, so then the function of the body will start breaking down, whether it's arthritis or degenerative joint disease or pressure on nerves, numb hands, numb feet, those type of things. So with that, the next question that I wanted to pose to you is, do you know why you're here? Do you know what you're having corrected when you come to the office? All right, and the only right answer for that is you're getting corrected. What is being corrected are what's called vertebral subluxations. The bones in the back are called the vertebrae, and a subluxation is when this bone moves right or it moves left or forwards or backwards, and it gets stuck like that. So by definition, a subluxation is an injured or damaged joint that is putting pressure on a nerve. Now, if left uncorrected, the vertebral subluxation, this injured or damaged joint that's putting pressure on a nerve, if that is left uncorrected, then that will lead to dysfunction and it will lead to disease. That disease is known as degenerative joint disease. So this is a progressive situation, which means if we check you and we find out we have this is not something that you just let go thinking again that it will go away, because it won't go away, and as it stays like this over time, it will get worse and worse. Now, the big part of chiropractic that I want to explain to you, and this is the main focus of this, is if we have a nerve here in the neck and this nerve goes down the right arm, and we take this bone and we move it so it's putting pressure on that nerve, well then it's safe to say, many of you experienced it, that your right arm will go numb. It will go tingly, maybe the fingers will go numb. Well, if you leave it like that long enough, what will happen is this arm will start to get what's called atrophy. The muscles will get smaller. You'll get weakness in the hands, not being able to open jars and things like that. And if you leave it there over long enough period of time, the arm will start to die. Same thing down here in the low back. If we move a bone in the low back and put pressure on that nerve, well, then we know that that nerve is that leg is going to get numb, or it's going to get tingly. You might get some leg weakness. Right? We can all agree on those things because most of us have experienced it one time or another. Now, the big question I have for you is, what's the difference between having pressure on the base of the neck or pressure in the low back, causing numbness down the arms and extremities and stuff like that? What's the difference between putting pressure here or here, and say putting pressure here on T2 that goes to your heart, or down T4 that goes to your lungs? Well, what is the big difference in that? And the answer is, there is no difference. If you put pressure on a nerve, then where that nerve goes to, over time, will not function at 100%, or will not function properly. If you take the pressure off that nerve, well, then that brain can send a message down the spinal cord, out the nerve to that part of the body, and that if that body's capable, it will start functioning better. That's the big picture of chiropractic. Now, at this point, I also want to stop and back up and tell you that I don't think chiropractic is a cure-all, fix-all for everything. That's not what I'm saying. But what I am saying, and what I have experienced in this office, is if you do put pressure on these nerves, then where those nerves go to, eventually the function will not be 100%, and will not be what it should be. That is why if you're ever in this office and you read the testimonial books out there, we don't pay these people to write those testimonial books. They do it on their own free will. And you'll be amazed at some of the testimonials you'll read in there. People with headaches, people with hearing loss, people with ringing in ears, constipation, diarrhea, infertility. The list goes on and on. I never claimed to fix or cure any of those things. But what I do know to be true is those patients came here, most of them with loss of hope, and we worked with them to align their spines to get the pressure off those nerves, and those symptoms went away, and they've stayed gone. So that is the big picture on chiropractic that I want to get across to you. Now, as a new patient, you also got your do's and don'ts list and a welcome patient packet. Make sure you read through those. If you have any questions, get back with me on that. I'll be happy to answer any questions you might have. The generalities on that are, we don't want to be wearing high heels. We don't want to be sitting with our legs crossed, putting undue pressure on the spine. When we're sleeping in the bed, we want to be on our side with a pillow between our legs. If you have a loss of the curve in your neck, you should be sleeping on a supportive pillow like the cervical pillows we have here to support the curve in your neck. Ladies, a big one for you is not to be carrying around 30-pound purses. So read those lists on the to-do list and get back if you have any questions. Okay? Now, the next thing I want to go through, and we're almost done with this, is hopefully you've seen that chiropractic was the right choice for you. And the part that I want to be clear on you with is, now you know that Wilber Chiropractic Clinic was the right choice for you specifically. Because like I've told you in the past, the thing that we do here and specialize in is corrective care. I am not a pain relief clinic where you come and get adjusted once or twice, get out of pain and be gone. We are more interested in making lasting changes for you in your health by finding what's wrong with your spine and fixing that structure so that it's corrected to the best that we can do. The last thing is, you got this information. I don't expect you to go out and be beating people over the head with that information to drive a bunch of people in here. But the thing I do want to get across to you is, we are a referral-based practice. Most of you watching this were probably referred here yourself by another friend or loved one or someone who thought that you could be helped with chiropractic. And so with that, the thing I wanted to let you know is, you have this information. So if you find someone that is in need, you're responsible just to explain to them, hey, chiropractic is an option out there for them so that they know. If you have a family or friend that lives out of state or out of the country and you want them to experience chiropractic, let me know. I'll find them a chiropractor wherever they are that does corrective care, and we'll try to get them there. If you find someone or know someone who's local that can benefit from chiropractic care, since you're a patient, you can always refer them here. We take care of all our patients who refer people here. We'll give you a certificate so that you can bring them in for $15. We'll do the consultation exam and all their x-rays. Well, I hope you learned something on this video. If you have any questions after seeing this, The next time I see you, let me know and we'll talk about it. All right, have a great day and God bless.